everyone, very good evening to all. Welcome back to my channel. Today I am going to start the another subject, that is a sociology. We are coming from the last unit, that is the seventh unit, that is a clinical sociology. Okay, so here the some topics will be there: introduction to clinical sociology, sociological strategies for developing services for the use of clinical sociology in crisis interventions. Okay, so this is also comes under one of the part of the 21 challenges for the BS nursing first years in first sem. So this is also applicable for the GNM, BSc, and all the whoever read you are going to read this sociology and also. Okay, so let me see the one by one. Okay, especially this is for the BS nursing first year first sem. They are going to write the examinations in the month of June 5th and 7th. That's why I have given task or like challenge. They have to complete the syllabus within 21 days. Then only they will get the good score in their examinations. Okay, so let me start the last seventh unit, that is sociology subject in sociology. Last unit, that is the clinical sociology. So let me see the introduction about the clinical sociology. Clinical sociology is the application of sociological theories, research methods, and interventions to social issues and problems presented by the clients. Okay, clinical is nothing but the related to hospital by the patients. Okay, that you have to keep it in mind. Okay, so mainly application of social theories. Theories is some systematic explanation of the studies and all. Okay, sociological theories, research, and methods. So, and interventions also. It's mainly to social issues and problems presented by the clients. Clients where they will set where they will stay in hospital only. So that is the reason we are calling as a clinical sociology. Means we can apply the theories by finding out the problems of the patients. Okay, this clinical sociology is the same as all sociology, that but it adds interventions, prevention of diseases, and social improvement components of its framework. Okay, not only application of the theories, methods, interventions to social issues and problems presented by the clients, even though sometimes we have to add the intervention. What we have to do? We observe some problems by the patients. What we have to do? In how we can prevent the diseases, what we have to add the components, that is nothing but the clinical sociology. Okay, so clinical means a problem solving perspective. Clinical means a problem solving okay, here the patient will have some problem, they will come to hospital for the problem, solving the problem by the doctor. Got it now? Okay, clinical sociologist deals with the problems in living. Some sociologists prefer the term sociological practice or applied sociology. Others refer to as doing sociology. It's mainly important to deliver the comprehensive nursing services. It's mainly important to deliver the comprehensive nursing services. Okay. So here the meaning of the clinical sociology means clinical means a problem solving perspective used to refer to medical work or teaching that relates to the examination and treatment of ill people. Okay, clinical sociology means medical work. Okay, clinical sociology means medical work or teaching or relates to the examination and treatment of ill people. That is the first point. Second one is involving direct observation of the patient. Second one is we are involving directly. We are observing the patient. Based on that, we are putting some interventions. We are framing the some framework in order to solving the problem of the patient. That you got no? Okay. So here sociology means study of social life, social change, and social causes and consequences of the human behavior. Sociologists investigate the structure of the groups, organizations, societies, and how people interact within these contexts. Sociology is nothing but the study of the behavior of the people in the society. That is, it may be life, it may be change, or it may be causes, or it may be consequences of the behavior of the people in the society. You got it now? Yearly, the sociologists who are studying who are investigating the sociology and all, so they may investigate the structure of the groups. They have to find out the groups. They have to frame the organization. They have to frame the societies, and based on that, he may find out. He may investigate how the people are interacting within the context, within this context. Okay, so here the clinical sociology has been defined as it's an application of sociological theories, research methods, principles such as individual, families, religious, educational, economical, and political mechanisms into clinical setting. Okay, so mainly for diagnosis, prevention of diseases, promotion of health, comprehensive care and treatment, and social medicine. That you have to clinical sociology. Say 2 marks questions they may ask na. Okay, that you have tried. Clinical sociology means application of social theories, research methods, interventions. It may be individual, families, religious, educational, economical, political mechanisms into clinical setting. That you have to write. And after that, for what purpose they are putting the clinical setting? For diagnosing the case, for prevention of diseases, promotion of health, comprehensive care and treatment of the patients. Okay, that is. So here the nature of clinical sociology. The clinical nature of the sociology is it's one of the branch of sociology. Clinical sociology concerned with the assessment and treatment of the physical, mental illness, social disabilities, emotional disorders, and behavioral problems. So mainly sociology, clinical sociology, it may be promote and human adaptation, adjustment. Okay, he may promote the human adjustment, he may promote the adaptation, he may improve the personal effectiveness, he may improve the satisfaction, and he may realize the behavior. Okay, mainly it mainly always clinical sociology focusing on the intellectual, emotional, biological, psychosocial, behavioral aspects of the human functioning across the lifespan in varying cultures and at all socio-economic levels. Clinical sociology science that generates research efforts to discover and validate information about what people are like and why they behave as they do. Clinical social analysis from confirmed sociological information to provide clinical realities to unsolved or undiagnosed clinical problems. The main meaning of the clinical sociology is improper use or misuse of something. Okay, improper use or like a okay, improper use or misuse of something. So here the main definition of the abuse you have tried here, the not clinical sociology. What is the meaning of abuse? The meaning of abuse is the improper use. If you are not using the proper, if you are not using something, improper use or misuse of something, that is nothing but the abuse. So here the main definition of the abuse is the okay, any action, it may be intentionally harms or intentionally injuries another person, that is nothing but the abuse. Okay, intentionally harms or intentionally injuries another person. Okay, inappropriate use of any substance, especially those that alter consciousness, alcohol, cocaine, smoking, any drug, etc. Abuse is physical, so sexual, emotional, economic, psychological actions or threats of action that influence other persons. It may be different ways will be there. The threats may be action, the threats of action that influence another persons. It will affect other persons. This includes any behaviors that frighten, intimidate, terrorize, manipulate, hurt, humiliate, blame, injure, or wound some. So these are the types of abuse. 13 will be there. 13 types of abuses. Okay. So this physical abuse, I am not explaining, just physically causing injury or trauma. Okay, physical abuse means intentional act or causing injury or trauma to another person by way of bodily contact. Okay, next coming to the child abuse, variety of harmful behaviors directed against the children. It can take many forms. Okay, harmful behaviors directed against children, harmful behaviors directed against children, it is nothing but the child abuse. Okay, elderly abuse, single repeated act or lack of appropriate action occurring within any relationship where there is an expectation of trust which causes harm or distress to an older person. It's according to WHO. Domestic violence or abuse, intimate partner violence, it is also called as intimate partner violence. Partner behavior in any relationship that is used to gain or maintain power or control over an intimate partner. Sexual abuse, molestation, abusive sexual behavior by any one person upon another. Abuse sexual behavior by one person upon another. This is taking advantage of another. Psychological or emotional. Okay, abuse characterized by a person subjecting or exposing another person to behavior. Okay, this is subjecting or exposing another person to behavior. Okay, next, financial and material abuse. Taking control someone else money to control them financially. Okay, money to control them. So this is modern slavery. Okay, this is the exploitation of other people for personal commercial gain. Modern slavery is all around us but often just out of sight. People can become making our clothes, serving our food, picking our crops, working in factories or working in houses or cooks or cleaners. Modern slavery. Exploitation of other people for personal commercial gain. That is. Okay, discriminatory abuse. When someone treats you unfairly because they think you are different, that is only. Treats you unfairly because they think you are different, that is discriminatory abuse. Organizational or institutional abuse. Mistreatment of people typically in their workplace, that is. Okay, mistreatment of people typically in their workplace. Neglect or act of omission. Neglect and act of omission includes ignoring medical, emotional, physical care needs. That is self neglect. Behavioral condition in which an individual neglects to attend to their basic needs such as personal hygiene, appropriate clothing, feeding, tending appropriately to any medical conditions and all. Okay. Okay. Technological abuse. Controlling behavior that involves the use of technology as means to coerce, stop, or harass another person. Controlling behavior that involves the use of technology. Controlling behavior that involves the use of technology. Next, so this is some services to preventing abuse. So they have given some services. Based on services, we can prevent the abuse. Because it is the 11 points will be there. Okay, sociological strategies for developing services for the abuse. This is the second. So till now I have given the introduction meaning of the clinical psychology. Okay, that is. So this is the second one. This is the second important one. Sociological strategies for developing services for the abused people. That you have to keep it in mind. Provision of information. Provision of information about the social structure and its consequences, enabling individuals and groups to use knowledge of social structure to develop more effective plans for group actions. Provision of information about social structure. What are the sociological strategies? So here the first one is the provision of information. First we have to provide the information regarding social structure and its consequences. We have to make the people to use the knowledge of social structure. That is the first. Second one is the use of sociological principles and data. Third one is the involvement of the individuals, groups, members in the planning processes, maximize the likelihood outcome. Okay. So these are the next last one is the uses of the clinical sociology in crisis intervention. This is the third point. Third subheading, uses of clinical sociology. Some mistake will be there here. Clinical sociology in crisis intervention is effective in preventing the developing of mental illness, but it can also be used in clinical setting to treat patients currently suffering from diseases. Okay, that is you have to know. Clinical sociology in crisis intervention is effective. When it is effective, when we preventing the development of mental illness, but it can also be used in clinical setting to treat patients currently suffering from diseases. Clinical sociology of crisis can reduce the number of repeat admissions to the hospital, and it's more effective than standard care at improving the mental state of a patient. Meaning crisis. What is a time of intense difficulty or danger? A crisis of meaning is often caused by the critical life events, failure, illness, death, divorce, or job loss. These are all things. Okay. Next, coming to the define crisis intervention. What is the definition of crisis intervention? It is a short-term management technique. Okay, crisis intervention is it's a short-term management technique. That's the first one. Second one is mainly designed to reduce the potential permanent damage. We can reduce the potential permanent damage to an individual affected by a crisis. Who are affected by the crisis, we can apply the short-term management technique. Okay, this technique is mainly designed to reduce the potential permanent damage. That is the main intention of the crisis intervention. Okay, crisis intervention is mainly defined as an overwhelming. It's an event which can include divorce, violence, the passing of a loved one, a divorce, discovery of a serious illness. Successful intervention involves obtaining background sociological information on the patient, establishing a positive relationship, discuss the events, and providing emotional support. Use of clinical sociology. Crisis intervention is a practice oriented set of procedures designed to offer someone experiencing incapacitating stress emotional first aid. Second one, the concepts and ideas found in the sociological tradition are quite applicable to crisis intervention practice. Next, what has been offered are alternatives to the traditional psychological and psychiatric positions. Fourth one, we can change strategies. First one is emotional first aid. Second one is sociological tradition. Third one is psychiatric position. Fourth one is the change in strategies. And fifth one is particularly the ideas found under the social psychology purview. It will serve well when practicing crisis intervention. And sixth one is the social act, in that the individual experiencing a crisis is influenced through the social circumstances. Seventh one is the social circumstances play a vital role in crisis formation and intervention. Eighth one is intervention strategies are offered which integrate aspects of clinical sociology while using a case study for application. We can apply in the case study for application of this one. The crisis intervention steps include crisis assessment, information gathering, control, direction, process, assessment, and referral. Through these procedures, the intervener may work with the client toward the goal of socio-emotional stability. These are the 7 uses of the crisis interventions. Okay, so this is the syllabus of the clinical sociology. Okay, don't thorough with the textbook, you have thorough with the syllabus. Okay, already I have given complete notes of the introduction to clinical sociology. I have given sociological strategies for developing services for the abused people. Third one is use of clinical sociology in crisis intervention. These are 3 topics you have to thorough. Remaining part just you have to go to the side headings. Okay, today I have completed the 7th unit in the sociology, that is the clinical sociology. Thank you all for watching my channel. If you like this video, please like it and make your friends to subscribe my channel. Then we need more contribution, then only we can raise our voices regarding different topics and all. Okay, thank you once again. Bye bye, see you in next video.